Hello, my name is Dr. Stephen Tugbiyele, and I am a board-certified urogynecologist at the Northside Center for Urogynecology here in Metro Atlanta. This is the first of many videos that I'm creating in order for women to learn a little bit more about me, about my personal background, my academic background, and professional background. To learn what the field of urogynecology is, what are some of the conditions that affect women that urogynecologists treat, and how to ultimately help women and give women the information that they need to make a quality, informed decision to improve their quality of life. So I'll start by saying that I was born and raised in Brooklyn, New York. I'm the firstborn son of first-generation Nigerian immigrants. I went to school in Brooklyn, and then at the age of 6, I actually relocated to Nigeria, lived there for 7 years before coming back with my family as a teenager. I know you don't hear the accent, but it's in there somewhere. I then finished high school in Brooklyn. I went to the City College of New York, Sophie Davis program in Manhattan, which is actually a 7-year Bachelor's of Science and Medical degree program. So rather than 8 years, I was able to complete that in 7 years, thank God. And then completed my medical degree at the NYU School of Medicine and in 2000. And then went and completed residency at NYU Medical Center, then finished my fellowship and my subspecialty training in urogynecology and female pelvic medicine and reconstructive surgery at the University of Maryland program and the Greater Baltimore Medical Center in Baltimore, Maryland. After completing that, left Maryland, relocated to Pennsylvania, where I lived and with my family, and I was at the Lehigh Valley Hospital Health Network. I was there for 12 years. I led that division for a number of years before relocating with my family to Metro Atlanta almost 3 years ago. I have a wife of 19 years and I have 3 teenage children. So that's kind of a little bit about my family background and academic background. I am again, as I mentioned, a board-certified fellowship-trained urogynecologist. And what is that? We are subspecialists who take care of very unique conditions of the pelvic floor, issues that women don't necessarily always feel comfortable talking about, but affects many, many women. And some of those conditions are pelvic organ prolapse, a fall or a drop of the bladder, the rectum, or the uterus, urinary incontinence, which is accidental urine leakage, fecal incontinence, accidental stool leakage, recurrent bladder infections, or we call them UTIs, childbirth injuries. Some women have had children vaginally, and that has affected how their pelvic floor works. And so we address those kind of conditions as well and help women with that. Complications to gynecologic surgery. Some women have undergone surgery that hasn't gone well, like hysterectomy, and there's some reconstruction or recorrection that needs to occur, and as urogynecologists, we take care of that. Interstitial cystitis or painful bladder syndrome. Some women have pain centered around their bladder that causes them to have to go to the bathroom frequently and have pain with relation to their bladder function, urgency, and they're in the bathroom and live there essentially for pain relief. So we take care of those kind of conditions. And overactive bladder, kind of a gotta go overactive bladder syndrome. Leakage of urine, laugh, cough, sneeze, jump, lift, exercise. Some women, bending over, any activity, jumping on a trampoline. I've taken care of many women who complain of that, moms, with their children. So that, we take care of that condition as well. And sexual dysfunction. A lot of these conditions affect women and their ability to feel attractive, their body image, and their sexual function with their partners. So these are very conditions that a lot of women feel embarrassed about and don't talk about, but it is very common. And because of our extensive training, we also take care of women who have special gynecologic or complex gynecologic conditions that may require specialized surgery, whether it's vaginal surgery or minimally invasive robotic laparoscopic surgery. So for example, abnormal uterine bleeding, fibroids, or problems emptying the bladder or the bowels. So we see a number of conditions, as you can hear, that affect the woman's pelvic floor. And again, these are common conditions that women don't necessarily talk about, but affect a woman's quality of life. A lot of women feel, I have to kind of live with it. But nowadays we tell women they don't have to. I tell my patients, you don't have to. There are good options that work and are safe and effective. And that that can improve your quality of life. And so I always encourage my patients to definitely do their research and come and speak to someone like myself, like a urogynecologist, that can talk to you about your options. And after an evaluation and kind of laying all the options out on the table, we can discuss the best way to come to an effective treatment that will work for you. It's very important to see a board-certified, fellowship-trained urogynecologist, because we have the training in this day and age to take care of these conditions, unlike what it had been in the past, where a lot of women saw perhaps their gynecologist or a different specialist, but a lot of women now realize that if there's an issue regarding their pelvic floor, whether it's the organs and the ligaments, the muscles, bones, and it also affects their bladder or urinary function, then seeing a urogynecologist is key. For more information, you can visit my website, drstephentugbiyele.com. That is www.drstephen with a PH, Tugbiyele, Tugbiyele.com. For more information, or visit my Facebook page or my YouTube channel, Dr. Stephen Tugbiyele. For more information, I do plan on making additional videos to really help women, give women that information they need to make an informed decision and feel empowered to improve their quality of life. And I look forward to going this journey with you. And if you have any questions, please do leave it in the comments below. I look forward to answering them and really helping women be more informed. Okay, thank you. Take care.